Alright, now that we've made the determination that we're going to go ahead and put this guy down using RSA, Rob, I'm going to have you start the IV and start drawing up meds, ketamine, Sux, and Vec. And then, Frank, I'm going to have you start doing, putting them on the monitor, get them on some O2 right away so we can start the pre-oxygenation process and get some vital signs once you get a chance. I'm going to start setting up all my airway stuff. And then once we have completed all those tasks, we're just going to take a time out and make sure everybody's on the same page and ready to go. Alright, so Frank, just leave me enough room on that table over there. I'm going to start setting up all my airway adjuncts over there. Check my combi tube here and make sure that's good to go in case we need in case we enter in a failed airway.
Heart rate looks to be 125. Put the pulse ox on?
Yes, please. Put the pulse ox on and let's go ahead and pull the end tidal out and get that warming up so that's ready to go.
Lay that right across your chest here.
IV's in.
Okay, 128.96. That's normal tensive. If he was hypertensive, we would consider Versed instead of ketamine, but let's go ahead and stick with the ketamine, Rob.
Okay, IV's in, flowing fine. We're saying this guy is 100 kilos?
Yes, 100 kilos.
Yep.
Alright, I'm going to go ahead and lay the patient down. Sir, we're going to lay you down flat. And so we got a blood pressure, we got a heart rate, we have them on the monitor, okay? And we have, let's put it in waveform so we can start warming up the end-tidal CO2.
Waveform?
What is our pulse ox right now?
It's 88.
88%, okay. I tell you what, let's go ahead and switch over to bagging. Why don't you get a nasal airway for me?
Nasal's in.
Okay.
Take over so you can finish.
Yeah, let me just check the compliance of the patient's lungs here. So far he's bagged fairly easy, alright? So we can ventilate the patient using a bag valve mask, so that's good. Alright. Alright, you got that stuff? Alright, I'm going to finish setting up all my airway stuff. Let's see, we have our C-collar out for once we get the tube in. And I have my primary airway, my combi tube, and also my crite kit just in case. We have all our basics going. Rob, how are we doing with the meds?
I'll be done in about 2 minutes.
Okay.
We're hooked up to O2 here too, as well.
How's the bagging going?
Still easy to bag.
Okay. I know we already took a listen, but while you're doing that, I'm just gonna... Okay, that's good. I'm not hearing anything in the stomach. Okay. That sounds good so far. So, when we get to the point where I'm going to intubate the guy after we have the meds on board, I'm gonna have you, once he starts giving the ketamine, I wanna have you do some crike pressure for me. And then once I go to intubate and the sucks is on board and we're done seeing fasciculations and all that, I'll have you continue to hold that as I go into intubate, and if I need to move it around, I'll keep your hand right there.
Drugs
And
are
then
ready.
also when I'm ready to intubate, I need you to hand me the tube, okay?
Drugs
All
are
right,
ready.
so let's just take a quick time out. Now that my stuff's set up, your stuff is set up, let's go over the meds. What do you got drawn up for me?
I got 200 of ketamine.
200 ketamine, how many
milligrams of
mLs is that?
Maybe 2 mLs.
2 mLs, okay.
I have 200 of succinylcholine drawn up, which
Okay.
is 10 mLs.
Okay, good.
And we have 10 of vecuronium set up, or drawn up, and that's 10 mLs.
Okay. Great. I will give you the time frames on when to give it. Remember, they're all IV push. And at this time, we confirmed that there were no contraindications to succinylcholine at this time. So let's go ahead. I'll take over the bagging for right now. You go ahead and start some crike pressure for me. And go ahead and give the ketamine.
Okay, ketamine, I've got taped to the thing that I have drawn
Okay.
up.
All right.
You put in 2 mLs, which is 200.
Again, we've been pre-oxygenating for a couple minutes now, which is good. We should be flushing out the majority of the nitrogen.
Okay, ketamine's in.
Okay, that's at 1351. In about 45 seconds, I'll have you give the succinylcholine. I'll give you on that mark. Bagging is still going good. Alright, so now that we got the ketamine in, we'll know when that's good, when we see some pretty goofy eyes going on. So far, they seem to be kind of really moving around, so that's probably starting to take place. We're at about 42, 43, 44, 45. Go ahead and give the succinylcholine. And then once that's given, we're going to be looking for the fasciculations.
Okay.
As soon as the
pushing in
fasciculations
sucks.
stop, I will go ahead and intubate.
Okay, sucks is... Sucks is in.
Okay. All right, that's at 1352. This could be anywhere from 30 to 60 seconds. If we don't see any fasciculations, we'll just look for the breathing to stop and also check his jaw. See if that's limp. Okay, we have fasciculations. So remember, when I see where I need to go, just hand me the tube.
Okay.
And we have the end tidal out, ready to go.
It's right here.
Fasciculations have stopped. Okay, and the tube. I see the cords. You see the tube passing the cords. Okay, and we are at 24 at the teeth. Inflate the balloon, and Rob, if you can take a listen for me here. Okay. Okay. Feels pretty good going in.
Okay, clear.
Okay, good.
Clear.
I do see some misting in the tube. And how's our waveform look?
We do the waveform.
We do have waveform. Looks like we're at about 48. So I'm going to just pick up the ventilations just a little bit to bring that CO2 down. We're going to try to maintain it around 40. Okay?
Go.
Let's go ahead and secure our tube before we give that vac. And then I'm just going to maintain my ventilations until I get our CO2 down to around 40. Okay, I have a seat collar over here. It's right underneath there for you. Let's go ahead and secure them with that. And then once that seat collar is secured, Rob, I'm going to have you re-listen to the lung sounds just to make sure we're still in the correct spot. Since we've been moving them around a little bit. Still have waveform.
Good lung sounds. Very good lung sound.
Okay, good. Let's go ahead and give the VEC.
And give 10 mL of VAC. What's that?
Stethoscope for vitals.
10 mL of VAC is going in.
Okay, we still got good chest rise. Compliance of the bag is still good.
Okay, VAC is in. Mark the time.
VEC is in, okay. So now, VEC goes in at 13:57. I'm going to have you guys help me keep an eye on the patient. If we notice any spiking in the heart rate, we might have to redose the ketamine again
Okay.
at a full 200 milligrams.
Blood pressure's unchanged, pulse ox is 97.
97, all right, we're getting better. And it seems like our end title's getting down close to 40 now. I'm going to have you go ahead and take over ventilations, okay? If you notice any change with that, if it begins to start becoming more difficult, or if we don't have waveform, let me know immediately. We might have to pull the tube and go with a combi. I'm going to go ahead and call the hospital at this time, let them know we're coming in. So we have a approximately 50-year-old patient, we thought, difficulty breathing, all right? Receiving hospital from ambulance number 123. How do you copy?
Emergency, go ahead.
Mercy Hospital, this is ambulance 123. We were dispatched today for an approximate 50-year-old male patient who was complaining of severe difficulty breathing. Patient, even with oxygenation and maintaining our ventilation, had a rapid desaturation of his pulse ox. Didn't seem like he was maintaining his airway very well. We decided to follow our RSA protocol and go ahead and intubate him. Patient is intubated and properly secured at this time. We do have waveform. We have stable vital signs. We will give you a full report upon our arrival. We are about 5 minutes out. How do you copy?
Emergency, copy that. I'll think that everything under control. We'll see you in about 5 minutes. Room 1 on arrival.
Copy that. Room 1 on arrival. All right. Let's just continue to maintain this at this time, and it seems like we still got good waveform and everything's going well. We'll just keep reevaluating until we get there.